Okay, so let's start. Remember what we're going to try to do during the whole day of today with the live injection and also tomorrow. It's a little bit to help you understand the behavior of all these products in the different type of patients that we have. And basically, I am going to try to imitate what can happen in our clinics with the different patients, to be very practical and help you implement all this knowledge into your own practice. So this is our first patient, which is a young patient and one of the classical patients that we can receive. So we can see in a quick evaluation that she has a good oval face, okay, a little bit of a shadow, the upper face, it's quite good. Okay, we could do a little bit of toxin, discord acellular in this glabellar line. Can you frown? Casually? Good. Frown? Okay, frown here. These lines, okay. A little bit of a shadow here and a lip treatment, but we are going to focus on the mid face, okay? So if I have a patient with a limited budget in my clinic, imagine only 1 ml, I will go for the lips. Why? Because with only 1 ml, I can have a final excellent result. If we have a little bit more budget, maybe for 2 ml, then I will take care of what she is concerned about, which is the nasolabial fold, a little bit of the tear trough, and a little bit of what she thinks is sagging a little bit. Okay, so we can see, remember that we have to evaluate in profile. So we can see that in the mid face, she has a clear visible bone structure here, and she has a negative vector and volume loss in the mid face. So look at her, look at this side. We can clearly see the bone structure. When we have bone structure visible, that means that we really need volume. We shouldn't be seeing the bone structure. She has a very little saggy skin here. So the priority in this case, as I was doing before when I asked you the question, does she need a lot of lifting? No. Does she need volume here? Yes. So my first choice is going to treat her in the mid face with volume. Now we're going to start because she needs volume. This is the area that it's visible, the bone structure, and this is the malar area that really needs volume. My sequence of treatment when voluminization is the priority, I'm going to start in this area. If I need more product or the patient has more budget, then I go lateral. This is the opposite of people treating all the times from the lateral cheekbone. If I start treating the lateral cheekbone, this will look more sunken. And this is something that Frank is going to show us now with the holotome, okay, with the bone structure of this area with the zygoma and zygomatic arch and how this malar area is the priority to volumize. So Frank, let's go with the holotome.
So Frank is just setting up here. Could you just tell us the product that you just...
Right, so I am going to use volume because the priority here, as you can see, is to volumize this area. We need to restore the volume of the malar region. So I'm going to use volume. I'm going to use a cannula, 25G cannula.
And what level are you putting the product on?
So I will go deep, okay? So we disinfect first. Remember, disinfection is crucial in all our ejections. So we are disinfecting now. I'm going to use a 25G cannula. I normally try to use the same size of the needle and cannula. So it's an orange needle for a 25G cannula. I'm going to pinch the skin. My entry point is going to be in the lower part of the triangle because here we have facial artery. You can see if you clunch and you palpate the anterior border of the masseter, we have facial artery being very tortuous going through the nasolabial fold. Here at the ala of the nose changes the angle, and this is why we call it angular artery, because there is a change in angle here. And also, if you open your eyes, look at the camera, in the medial part of the pupilla, not mid-pupillary lane, medial part of the pupilla, you palpate the orbital rim, which is here, and then 0.8 below here is where we have the exit of the infraorbital nerve. So what I'm going to do is I'm going to go from the lower part of the malar zone, which is a safe area for the entry point.
Okay, so I'm going to start.
Sure, go with the holotome while I inject.
I'm going to start. I want to tell you that this is a pioneering technology. This is a surprise that we have for you. It's called the holotome. And the holotome will be something that you've never seen before. It's something that creates the 3D image that I told you about to be able to be better injector, to help your brain become a 3D injector. And what we use is a combination of very advanced technologies. I'll tell you what we did. First, we captured the 3D structure of the anatomy of my personal assistant in my clinic in Mexico. Her name is Natania. We'll call her Natania, right? You can see her there. Then what we did is we created, with innovative software, all the anatomy in 3D. After that, through facial landmarking, we adapted that technology to that bone structure, so it's personalized. The anatomy is almost her anatomy. It's not exactly the anatomy, but it's very close to be. And after that, we're using some special new technology like augmented reality. It's not virtual, it's augmented, it's called mixed reality, to project this image in space. So what you see on your left corner in that little cave, and I want to thank Ahmed because he is holding the lenses. He will be our cameraman while we move and we show you what's going on the live demonstration. Right? So say hello to Natania,
Right,
please.
Frank, so can we see the holotome now?
Yeah, we can see the holotome and I can explain. So, as you can see,
Could we show where Juan is injecting on the holotome,
Right,
please,
so
Frank?
Yes, so we're
what I
gonna-
have done while you see the holotome, what I have done is with my cannula, I go to the deep layer and I touch the bone. So when I touch the bone, I release a little bit my cannula, and first of all, I do a small bolus because I want a little bit of a longer duration. And once I've done a 0.3 bolus, which I'm now reaching, okay, I always put my finger to protect the area where I don't want the product to go, which is this finger here, avoiding any product to be spread into the nasolabial fold. Now I pinch the skin and I do a little bit of a linear threading. All my product is in the deep plane. And now, because I want to volumize this area, I can do a fan technique with a linear threading, okay, towards the more lateral point, towards the zygoma. So Frank, do you have the holotome there?
not yet, you can continue.
Right. So I am injecting Restylane volume because the priority here is to volumize this area. And I also want to show you the indirect improvement of the tear trough. So imagine that in our clinics, we don't have enough budget, or the patient doesn't have enough budget for all the treatment. The first thing we have to do when we want to improve the tear trough is to treat the meat face. Okay, so I am going to inject 1 ml, and I'm going now towards the zygoma to create a continuous convexity, what we call the Oggi curve, very slowly infiltrating with my cannula. Very slowly. Now I'm doing the fan technique. Remember, if I do like this with my cannula, you cannot see my cannula. Okay? You're okay? Right.
We do have to mention that at the area where you're injecting, we have to be cautious and conscious about the infraorbital foramen.
Right, so the infraorbital nerve, it's more medial, the exit, it's more medial as I draw with my pen.
Exactly.
You know, it's a little bit more medial, and I always have my finger protecting. So when we finish, we mold upwards towards the tear trough. Okay? Now this product is level of cross-linking is 3, but the particle size is the biggest. So now we can see the result. Can you sit up? Right? So we can see the result here. Wait. Okay, look how we have corrected this negative vector that we had in the malar area, and look at the improvement of the tear trough, indirect improvement of the tear trough.
Yeah, it's pretty obvious on the big screen.
Okay,
here,
so
yeah.
we can see the other side. We can see clearly how she needs the volume. If I started lateral in this case, you know, we would have needed a lot more product in this area.
That's
and look
true.
at the tear trough. We have already improved 80% of this tear trough.
Absolutely, we can see it so
Okay.
marvelously here. Yes.
Again, indirect improvement of tear trough, indirect improvement also of the nasolabial fold. Okay, we can see the nasolabial fold, it's almost corrected. And in this area, we can see the nasolabial fold, which is deeper here.
And it didn't take you so much product to correct that.
Well, I did inject 1 ml, but I mean, I did the whole area towards this zygoma. Okay, so we can see a nice Augie curve here now.
Absolutely.
You can see that Augie curve. Okay. Now, if I have a little bit more budget, imagine that she wants to improve a little bit the tear trough. Now, I only need 0.1 or 0.2 in this area. Because she's young, the product that I'm going to use in this case, it's going to be Refine, the old classic. Okay, so she has a good thickness of the skin for a young patient in this area, although we know this is the thin skin, but she's younger than other patients that we can have in our clinics, and that's the reason why my product of choice is going to be Restylane Refine. A small particle size and level of cross-linking is 2. It's easy to mold, and I'm going to use a needle for those of you who want to see a needle treatment in this case. We will have other cases with cannula.
And what would be the level of positioning of the product?
Right, so I'm going to go completely perpendicular. Okay, so this is my Restylane Refine. I'm going to move a little bit the patient. So I'm going to start medial and lateral. I don't want my product and my needle to go in this dangerous area. So what I'm going to do is I'm going to do my point in the medial part, in the midline, and because it's a moldable product, I will push with my finger towards this area, towards the medial part, which is the dangerous area with the vein and artery. I'm going to go completely perpendicular. I have to palpate the orbital rim. This is the orbital rim. And here is the exit of the infraorbital nerve. So I have this space in the middle where I'm going to go completely perpendicular and touch the bone under the muscle.
Okay, so we're back.
Right, so you have your holotome ready?
Yes.
All right, let's see it. We're
Go
all
ahead.
excited here.
Can we put
Screen,
on the,
please.
the side, please? So what he did,
Right,
let's see it.
that's it.
Okay. So now we're fine. So there she is.
Okay,
Okay, so now what we're gonna see is if I take her skin away, see, I can play with layering.
right, Frank, so can you explain first the projection of the zygoma and zygomatic arch, why we maintain that volume when we age?
Exactly. So we'll go here laterally, and I'll show you. That's the zygoma. And the zygoma, it's a bar that is the strongest bone in the body. So we use it for lifting. It's very good for definition, highlighting, and lifting. Is these areas. For example, if you want to define,
Right.
these
So-
points will be important.
So we can see that there is bone there, but the malar area lacks bone when we age. There is reabsorption of that bone, and that's the reason why when we have to volumize, we focus on this area. You can see in the holotome, when in red now, all this projection.
That's a projection, but if you did some,
Right. Can you show now the fat pads that we are restoring with our voluminization, the malar, deep malar fat pad, Frank?
now you see the fat pads. In a second, we have some lagging.
Right, so there are the fat pads. We are restoring that fat pad with our volume, Restylane volume.
But as you see, what I draw on the bone is below. It's covered by the fat pad itself. So when we inject for volumization in the mid phase, then we are using the malar bone as our main projector, right? That's the bone we want. So in this case, I'm always going to try to use red when I'm using OBT technology and blue when I'm using NASHA technology. And forgive me if I better injector than a pen drawer on my phone. So if I have to correct it until we get it right. But the area that has to be volumized is straight on the bone around here. All this area will have to be, all this area will have to be, in this case, you used OBT, right?
Yes, Restylane volume.
So we're gonna do it on red.
Right, so I'm gonna keep going with my injection of the tear trough. Can you please show us also the facial artery and the infraorbital notch?
Okay, are we having trouble there?
Right, I'm going perpendicular on bone. I touch the bone. And what I'm going to do is I'm going to do a small deposit of 0.15.
Oh my God.
Only 0.15. Can I have a gauge? That's it. Now I am going to mold towards the medial part of the tear trough. I'm just going, this is a product that it's very easy to mold. So I am avoiding risks. This is the first patient, especially for the beginners that want to start treating the tear trough. Remember, the teaching thing here is first treat the mid phase, then we treat the tear trough directly with the needle, completely perpendicular, and we mold the product toward the medial part. Okay? We cannot probably correct 100% of the tear trough, but this is a good thing. In the first session, try to correct 70% of that tear trough, because with the retention of water, we want to avoid any problem. So in 15 or 20 days, you can add a little bit more, and I think this is enough. Okay? So stand up. You can see our patient. Okay? Can you look at the camera? So this is the non-treated side. Look at the camera. We can see her a little bit in profile. Okay? Look at the volume loss, tear trough, nasolabial fold. And if we see her now, we can see the improvement. She looks better for her age, but she doesn't look overdone because we have not treated the whole mid phase.
No,
and
she
we
looks
can see
improved and very natural. Yes, very nice job.
vector. And the correction of the tear trough almost done, 75-80%, with only 0.15 of refine. Okay?
Could I just ask if anybody has any question, raise your hand. Mike will come to you because we would love to have an interaction here. And I have one first question here. Could we have the mic to the doctor here? Could you raise your hand so he can know where you are?
So my question is that while we consider the budget, if budget is an issue, so do we think that going with the needle, with bolus technique would have been much beneficial than opting for the cannula?
Right, so that you mean for the mid phase, yes?
Yes.
So I agree that when we use needles and we do a bolus technique, we might need less product. But to be honest, with only 0.5 here, you will not have an excellent result. So if I have a limited budget in this patient, and she only can afford 1 ml, instead of injecting 0.5 and 0.5, she will look better, but she will think she's going to look much better. I will dedicate or convince my patient that she also needs a lip treatment, and with 1 ml, she will be happy with this. So what I don't like to do is to treat with not enough product patients that need a little bit more. So I will not accept an indication if I don't have enough product to show my excellent result. She will be very happy with the lip treatment with 1 ml. She will come back and she will add extra budget for sure, for the mid phase, because she will be happy with the lips, okay?
All right, that's good.
Right.
We have just one question before we move on. Go ahead.
Can we use cannula for the teardrop?
Sorry, I can't hear.
So
Yeah.
the question is, can we use cannula for the tear trough?
Yes, we can, and definitely you're going to see 3 or 4 cases today of cannula. This is one of them. We have a new patient, as you can see, okay? But when I only need 0.15, and it's only a little bit to improve that tear trough, I don't want to take the risk of having to do a cannula treatment, which is a little bit more uncomfortable, and I don't think that for 0.15 it's worth the cannula treatment. A direct approach in the tear trough with that needle was enough in this case. Now we have a deeper tear trough. This is a different case, okay?
Yeah, so you could start explaining the new patient that you have here.
Right, so markers. So this is the second kind of patient that I thought it was interesting for you to see, because she's also young. She also wants to improve her tear trough, and also she wants, we know that to improve the tear trough, we need to treat the mid phase. No, zoom out, zoom out, that's it. So, but if we see her on this profile, we don't see the volume loss that we saw before in the other patient. So this is a different kind of patient. If I treat her with a volumizer, I am going to over-treat this area, and she's not going to look natural. So going back to the way to decide the product, does she need a lot of volume? No. So volume is finished. Does she need a lot of lifting or projection because she has a lot of saggy skin? No. So lift is finished. My product of choice here is going to be Restylane Define, the versatile product. It's going to give me a little bit of volume, it's going to give me a nice projection, a very elegant cheekbone, and I don't have to over volumize her. Now, the priority here is to project, so this is going to be the area of projection. This is going to be the area of lifting, and this is going to be the area of voluminization. Volume, projection, and lifting. As we have seen with the holotome, we lift from here, we project the zygoma, and we volumize the malar region and the fat pads, right? So I started medial to lateral in my first patient. In this patient, I'm going to start lateral to medial, and she will need more product lateral and in the zygoma than in the medial part, okay? In this case, when I want projection, and also answering the question that was made before, I'm going to use a needle and I'm going to use a bolus technique. Okay? So the first point is going to be in the junction between the zygoma and the zygomatic arch. We can palpate an indentation. Normally it's quite easy to palpate. So we have to go a little bit lateral to that point or a little bit medial, because that's the exit of the zygomaticofacialis nerve and artery, okay? So relax, look at the camera. We stretch the skin, completely perpendicular. I touch bone. I'm just going to do a 0.15 or 0.2. Very slowly. The speed of infiltration also plays a role. 0.2. That's it. Now look at this nodule. This is the ending point of my treatment. I need to see this exaggerated nodule, because just with one touch, still an OBT technology, now I have the exaggerated nodule has disappeared, but I still maintain the projection and the contour of the product. Okay? Second point, can you disinfect? Can you stop talking? Okay. Can you disinfect? Okay, 1 centimeter lateral to the icanthus and 2.5 below, more or less as a reference. I'm going to stretch the skin, going completely perpendicular, and I touch the bone. This is the point of maximum projection. Very slowly, I will add a little bit more than in 0.1, which is 0.3. Now remember, look at my angle of infiltration. My syringe is pointing upwards. If I point downwards, all my product will go down there, and I don't want that. I want to project and to lift a little bit the skin, create a new shape. So that's our second point. Wait, I want to show you how a little bit exaggerated the nodule. So instead of looking at the syringe, you just have to look at the skin of your patient. Okay? Look how we are lifting all this tissue and we are creating this shadow that many women want to have with makeup. They do make up this area with a little shadow to highlight the cheekbone. So we can have this as a natural thing.
So your main goal here is to define the cheekbone rather
Exactly. We are contouring, we are creating an elegant high cheekbone. We will see when I finish the final result. Okay. So we go now to the malar region. Remember the facial artery. I can put my finger in the no-go area. I don't want any product to go in the nasolabial fold. I don't want any product to be injected into the vessels. So
Okay, so now we're showing the vessels, finally, the
Right.
holotome.
okay, so you can show
So you
the
can
vessels.
see there
Right, go ahead, Frank.
the vessels that worry us.
Right. So I'm in the middle, I'm lateral to facial artery, and I'm lateral and lower than the infraorbital notch. Okay. So I will do my final bolus here of 0.35.
He's exactly below the fat pads,
I'm touching the bone all the
touching
time.
the bone.
That's it. Okay. Right, so can you take this?
So
Can you sit up? Right, look at the camera. Now look, let's look at her. We can see how we have beautified this lady, okay, with a very elegant cheekbone. Look at this shape. Look at this volume here. And look how we have lifted and created this nice, elegant cheekbone.
Juan,
Okay.
we have a request. Could we see her in animation? Because some of
Yes,
the
can you
audience-
smile? Smile, give me a big smile, come
Yes.
on. Oh, look at that, when she smiles, we are not over treating her like this, also because we are in the deep plane. When we inject deep on bone, that's a fixed plane. Those fat pads are attached to the bone. If we inject too superficial, those fat pads are mobile, and then when they smile, they move our product upwards and they have this aspect,
Right.
okay?
So these areas that I'm painting in red are the ones that are being filled. If I put the deep fat pad on top, you will see that it corresponds to the deep cheek fat compartment. So that's the correct area to put it.
Right. So look at, don't smile now. So look at that nice OG curve here compared to this area that she has a good, she's young, but it's not that highlighted. This is a beautification, okay, using Restylane Define.
Very natural.
And I
very
want to highlight again, look at the tear trough. We have not, can you look at the camera? We have not improved in this case the tear trough as much as we did before with Restylane volume. So that means that we can create the shape, but the indirect approach, we have a little bit less, effect. This is why we're gonna go for the tear trough with a product that it's my personal experience and recommendation. So the product I'm going to use for the tear trough is the product that has the lowest concentration of HA. For the tear trough, I prefer products that have a lower concentration because I don't want any retention of water and I don't want any Tyndall effect in this area. So my product of choice is Vital Light. Remember, Vital Light is 100% cross-link, still a Nasha technology, so it still have lifting capacity of this thin skin. But at the same time, it's the only product with a concentration of 12 milligrams per milliliter. We can talk about this later in a discussion, but I've been trying to find the best product for the tear trough for years, and I finally realized that this is 100% cross-link, and it was only 12 milligrams per milliliter. In this case, I'm going to use a cannula, 27G cannula. So I'm going to go to my entry point, pinching the skin. I do my entry point is just a little bit of the needle. I always try just a little bit. It's a 27G needle. I hold my syringe like a dart to be stable and I get in. Look how easy it is to get in with the same size. Now I'm going to pinch the skin to make sure that I reach the bone. So now I know if I try to elevate my cannula, I don't see the cannula. Can you close your eyes? Now I'm going to do a small aliquot, and I can see how the skin is starting to lift in this area. Okay? 0.1. Now I stop, I move backwards, and I go a little bit more lateral, 0.1. Don't move, Victoria. Okay? Now lateral, 0.1. I'm doing 0.1 deposits above the orbital rim. Now I'm going a little bit more lateral, 0.1. You can see I'm here. And I can also go more lateral to the palpebromalar groove. Frank, can you show us where all the area that I am injecting now?
Before he shows us this, because he's having some difficulty, but could you just say why are you correcting that lateral palpebral groove?
Right, because we have projected this area, we have created a contour,
Right.
and we have projected the zygoma and the zygomatic arch.
Right.
Sometimes we can create a little bit more sunken palpebromalar groove. So it's not a real indication in terms of that she needed, but once we've done this, I don't want to create a problem here. It's just, I have injected 0.4 in total. Now what I want to show you now, it's how it goes superficially. Look, if I go superficial above the muscle, look at my cannula. You can clearly see my cannula here.
Yeah, it's quite clear from
So
here.
every time inject under the muscle, okay? Because I'm using Vital Light, and this is my personal recommendation. The company does not have yet studies regarding the tear trough and this product, but in my experience, after 3 years, it's a fantastic product to inject. Only inject the deep area, but I have found that injecting just a drop, look what I'm going to do now, just a drop in the superficial part, it's just a drop. I'm not even moving the plancha. It can improve a lot the dark circles. And it's very easy to mold because remember, this is Vital Light. It's just a drop, less than 0.1. Only for very advanced people that I know we have in the audience, I'm doing this. Some people might see a few times if there is some swelling or retention of water. If you ask me, have I seen retention of water with this product? In 3 years, the answer is yes, 3 cases. I had 3 cases of a little bit of water retention that when they woke up, they had a little bag with a little bit of water that was improving during the day. 2 of those cases resolved with no treatment. They just massaged, and in a few days it was gone. Okay, and 1 of those cases, I had to inject 5 units of hyaluronidase. It was nothing. It was a drop, very superficial with a needle in the superficial part, and it was due to the superficial deposit. My recommendation in this case is start with the deep, okay, the deep plane, and then in a very few cases you can add a drop. I'm going to show you now the result. Can you look at the camera? Okay, can you zoom in a little bit? Right. So this is the result. You can see, go down a little bit like this. That's the non-treated area, a little bit of a flattened cheekbone. Look at the tear trough. Although she's young, it looks great, okay? And look at this area. We have a high cheekbone. You can look at the camera. Okay, look at the tear trough. It's almost corrected. Not only that, also the darkness. Look at the dark circle. If I do like this, if I do like this and I bring the skin up, look at the camera. Look how we improve that shadow. This is dark. This is less dark. I mean, it's lighter. So a lot of people are using treatments, depigmentation treatments to reduce the pigmentation. And this is a shadow due to the lack of projection of this skin. Look how we have improved that dark skin. Okay?
Juan, we have a couple of questions.
Sure.
First of all, when you were talking about the zygomato-facial foramen and
Yes.
project, could you just mark it just one
Sure.
more time for
So,
the audience?
look, if you palpate the zygoma and you go through to the zygomatic arch, you can palpate an indentation, which is here. You can see the fusion between this bone and this one. So this is the fusion line, okay?
Right.
So this is the exit of an artery, which is the zygomatico-facialis artery and nerve. It's not a big artery. It's difficult to hit this artery and to have an intravascular deposit, but it's always a reason to have a bruise there. which to me is not a problem. We know that we are injectors and we can bruise, but I mean, you have to be aware that there is an artery there, okay?
Right. And when you started to correct the lateral palpebral groove, did you go up to the lateral canthus or just smoothened out your borders?
So I did go till the ligament, the attachment of the ligament. So
Right.
I mean, this is the ligament and the attachment. So I was probably in this area, okay?
Right. And is the amount of vital light under the eyes consistent or depends on the patient
So
needs?
look, I have used, if you see this on the cameraman, I have used a total of 0.6 of vital light for this correction. I could have used 0.5, okay, because remember that in our clinics sometimes, you know, we have to spare a little bit of product for the other side, but it's not much, and this is a product of 12 milligrams per milliliter. The amazing thing is that if I palpate now the skin of my patient, I don't palpate any nodule, any product. And remember, this is a skin booster. It will also improve the very fine wrinkles that some patients have
That's
in
a very
this
good
area.
point. That's a
Okay.
very valid point.
Now, let me show you on my hand what I did. Can you go here, cameraman? Okay. So what I did was, look, 0.1. No, it's okay. 0.1. I stopped. I did 0.1. I stopped. I went, and again I did 0.1. And I like to stop and do these 3 boluses or aliquots, because then this product will distribute in the area better than if I create a barrier. Now, look at what I did above the muscle. Now, it was just a drop, just a drop, just a drop, just a drop. This is the amount of product that I injected above the muscle. It's not even 1/3 of this.
Right.
So be careful with this. Don't do it in the surface above the muscle unless you have someone with dark skin, very dark skin, and especially when you have experience with the product under the muscle. The safe thing is to do it under the muscle. Look, this is still a cross-link product. It's 100% cross-link, and I know it's a skin booster, but I'm using it a little bit as a filler for this area. My experience is fantastic, but I tell you again, this is my personal recommendation. I'm sure that Galderma is happy to start, you know, future studies, you know, to demonstrate my good personal experience with this product.
Yeah, I'm sure they are.
Okay?
Yes, absolutely.
So this is patient number 2. Remember, we have injected volume in the first patient, define in the second patient, refine in the first patient, and vital light in this one. So we're treating different patients with different products, real personalization. Okay?
That is the essence of personalization with this portfolio, and you're showing that in a very great way. So just to have a sense of the audience, is there any questions on the positioning of products that we discussed, or Juan just simply... Oh, yeah, we have so.
Look at the camera.
Could we pass the mic there?
Okay, so am I
we
back?
Just no, we just have a couple of questions while you're
okay.
coming back.
Yeah,
Go ahead.
So we are now changing the idea about the volumizing. So if this patient was a male, okay, what you are going to do for the cheek?
Sorry, Sofiani, I don't hear the people.
No problem. So he was asking that if the patient you're treating just now was a male, would that differ in the decision of what product to use to volumize?
Definitely. I agree with the person who made the question. If I have a male patient, probably the thickness of the skin in the mid phase is going to be thicker. So I need something like Nasha, okay, that doesn't integrate, restores that volume, but at the same time, you know, gives me projection. And for the tear trough, I might go for Refine or even Restylane, as we are going to see now in our next patient. Okay?
Okay, so we'll take just one more question, maybe a 2. We'll see. Go ahead, please.
Yeah, my question is, sometimes we do have some depressions in the border of the nose and the start of the cheek, below the tear through area. And when we try to sculpture that area with our fillers, we sometimes have a lymphatic blockage, and there is a kind of edema existing for a long period of time. In this stage, which product should we choose, or is there another strategy for us you can recommend?
Right, so I agree that one of the reasons why we obstruct the lymphatic drainage in this area is because the thickness of the product is too thick, okay, and the skin is too thin. This is the reason why Vital Light, being a Nasha technology, still give me a lifting capacity. You're going to see our next patient that we're going to have a Nasha technology that lifts, but at the same time, it's soft. I mean, you have seen that product. It doesn't obstruct any lymphatic drainage because it will distribute in the area, and it doesn't create a barrier. It's really smooth and easy to mold. So I have never seen lymphatic obstruction with Vital Light or with Finesse. If you want to use Finesse for this indication and you have that hollow that you are commenting, it's nice also Finesse if you need a little bit more HA in that area. Finesse is a soft product with particle size 1 and cross-linking 1, still very soft, and it could be also a good option for those cases. But I agree, if you use something very thick, you can have an obstruction of the lymphatic drainage. Can we go back to the patient?
Could we have the screen on, please?
Right. Third patient for the mid phase. Remember that we have patients, now we start with the difficult ones. I don't want to show you only young patients. We have this less young patient, okay? Look at the camera. And this, of course, you're thinking about other indications that we can see. We can see the saggy skin here. We can see the barcode. We can see a lot of indications on this lady, but we are going to focus on this session on the mid phase, okay? So look at the camera. Again, I need to improve the tear trough. I need to improve the nasolabial fold. I need to improve, look at this saggy skin. And this skin is quite thick. So do I need, look at the lateral view again. Do I need volume in this patient? No. Do I need something that will integrate into the tissue, creating a thicker skin with no support? No. So my product of choice on her is going to be Restylane Lift, because my priority is to lift, okay, this area, although we also have a little bit of volume replacing, you know, with any product. So let's go for lift in this case.
And what will you be using, a needle or a cannula? In this
So because I want, can I have an example of any product to do here? So because I want here lifting capacity, I prefer a bolus technique with a needle, but you can do with both needles or cannulas. If you are a cannula user and you're a fan of the cannula, you can also do it with a cannula. But let me show you, you know, what I'm going to do here. So this is Restylane Lift, okay? So what I'm going to do in my hand is, this is the bolus. I'm going to do it on the face of the patient. Look at this. So if I inject here a bolus with a needle, this is the bolus that I'm going, this is only 0.1. Imagine if I inject 0. Look at that projection.
Yeah.
Okay? Now, if I do another one here, that's another 0.1, and I'm going to use more product than this. If I use a cannula, my tendency is to go more linear threading and spread the product a little bit more this way. That's the way I use cannulas normally.
Right.
So I lose projection and lifting capacity when I use a cannula than when I use a bolus and I want precision, right? Of course, you can go with a cannula till here and do a bolus as well. But I think, you know, it's better to go directly to the place that we need and do the bolus, okay?
I think that depends on the comfort of the injector, and that's the beauty of these products. They give you the leeway and flexibility to personalize even the technique that you want.
Right. So it's fine. I mean, there are many different ways to achieve good results. My technique is not the only one. I'm sure that all of you there, and you have very good results with your patients. So there are many different ways to do things. I'm just showing in my experience and sharing with you my experience. Pick up what you think is interesting and keep doing what you think it's better than what I do. So this is just a way to explain you the behavior of the products, you know, in our patients. So first point, zygomatic point again. So I palpated the indentation that we highlighted before. Because I have touched with my glove now, I want Victoria to clean again the entry point. Look, disinfection, it's crucial. We go fast, We have a lot of patients waiting in the waiting room. You really need to be careful with the disinfection. So now I touch the bone and not even all my needle is in. Because Nasha is a hard product, Restylane Lift, okay, I'm going to go very slowly because this product is harder, so the patient can feel a little bit more than with OBT that we are, infiltrating the product. So I go, look at the speed of my infiltration. It's quite slow, very slow. Okay, with 0.1, I'm not going to do anything here. I need a little bit more because the priority is not to volumize. I'm going to inject more product, lateral than medial. So I have one there. Wait. Okay, look at that projection here. Okay, we are starting to see a projection. Now this product is hard. You can actually palpate the bone structure and it imitates bone structure. I don't like to mold very hard. Okay. Second point of maximum projection, it's 1 centimeter lateral to the acantus in this area, 2.5 below. This is going to be our point of maximum projection. In a male patient, I will make it more medial and lower because I don't want a high cheekbone for a male. So in this case, completely perpendicular. With my needle, I touch the bone, okay? And then I go slowly. I want 0.35 here or 0.3.
And while you're injecting, if you don't mind, we could take a couple of questions. Is that okay?
Sure,
with
of
everyone?
course. That's nice. That's what I want. Okay. So 0.3, second point, we mold. And now we go to the medial part for an extra 0.25 or 0.23 I have.
Okay, go ahead. What's your question?
Doctor, I wanted to ask you that how important are the ligaments while we are injecting our fillers?
Well, the ligaments are extremely important, okay? I think that, the ligaments are the clue for the attachments of the skin to the deep layers. And this is the reason why we have a line of ligaments that delimitates the area of voluminization compared to the area of lifting and projection. I think, Frank, you can use the holotone to explain that.
Yeah, I think Frank even showed it in the previous lecture where he showed the ligaments and the importance of lateral lifting and medial volumization. But while Frank is putting his thing up, I have a question.
Right, so let me show you that we have the temporal ligaments, we have the orbicular retaining ligaments, we have the zygomaticus ligaments, we have this way, we have the zygomaticus ligaments, we have the masseteric ligaments, and the mandibular retaining ligaments. So all this area, it's an area of ligaments. So these are the attachments, and this is the reason why when we lose volume, okay, all this skin sags here, but because we have the attachment of the ligaments, this is the area of sagging, but not this one. Okay?
But I can
so
control
this
it,
is
you
the
see?
area
I
with
can
these
do it.
attachments.
So you need to
If
tell
I
me
inject a lot of product in this area, in the medial part, expecting a lifting effect, it's not correct because all the product will project the malar area or the cheek area or this area, but I'm not having a lifting effect because there is the attachment of the ligaments. So this is a voluminization area, and all this is the lifting area. So when I really want to lift, the priority, it's all lateral.
To deliver that message home, Frank has put up his holotone. Frank,
Right.
Could you show us where would the retaining ligaments on the zygoma and the other areas like the malar and mandible, please?
I see.
Okay, sorry for that, these glitches, but like I said, ligaments are hugely important.
Yeah.
So the first one I will say is basic,
Look at
is the ORL. And the ORL is a ligament that goes around.
Could you look up a little bit because we cannot see? Yeah.
Yes, just a second, because now
Well,
I'm doing everything. So now, more or less, you can see where the ligament goes. And this is my barrier for any injection that is periorbital. So always, if I want to inject, for example, the tear trough, it will have to be below that ligament there. In red, you're going to see it.
So why don't you put all the marks for the retaining ligaments? Because
All that- okay.
Juan will just explain his final results and we'll come back to you to see the whole thing drawn on the holotone. Juan, could you just show us your marvelous
Right.
results?
So I just want to highlight, can we sit up my patient? I just want to highlight that I only injected 1 ml, okay? And we can see the shape here. We can see how we are actually lifting this skin. Okay, look at this. If we see her on profile, you can see that we have not over volumized her. Okay, although we can see the shadow here and a higher cheekbone. We're
Right.
going to do a lot more things on her mid face today. Look at this. Okay, look at the saggy skin down here. Okay, and look at this side. We're starting to improve the saggy skin. You can, yeah, that's fine. Okay, and look at also this. We're starting to improve the nasolabial fold. But she obviously is an older lady that needs additional treatment. So let's go to the nasolabial fold itself now, okay?
Yep. Frank, do you have the retaining
okay?
ligaments drawn or should
You're
we?
okay?
Can I have my, okay, so remember we have 2 ligaments that are important in the mid phase other than the ORL. First are the attachments of the 2 muscles. So you have the zygomatic minor around there. In green it's going to appear in 1 second. There's a little bit of a lag. And you have the zygomatic major a little bit further away. So these are ligaments that we need to be aware of. Then we have the lateral orbital thickening, which will appear in a second.
And why are those significant, do you think?
Because I will explain that these are the ligaments that make that plane that is so important to differentiate between volumization and the area of lifting, which we use the zygoma for. Actually, the first ligament that starts that ligament plane is a ligament that is called the temporal superior ligament, and you will see it there appearing in just a second. And this will make then, together with the mandibular ligament down here, if you can look a little bit lower, if you can look a little bit lower, okay? So this is a line that is hyper important for us. There you have the mandibular ligament. If I join this with a line, this is my plane of differentiation.
Right.
In red, you're gonna see it now, there. Okay, so everything that is medial to there is good for volume. Everything that is lateral is good for lifting. And now tell me what technique are you doing and I will try to follow up.
Right, so I want you, because you have now the bone structure, once we've done this mid-phase treatment, of course we would love to do this, but this is surgical, okay? But now once we have improved from the mid-phase, we can now achieve directly the nasolabial fold. So now I'm going to use a product, and again I have 2 options, either Restylane Define or Refine. Because she has a deep fossa, piriform fossa, I have chosen my product on green, which is Define. Gives me support in a mobile area, gives me some support and also a little bit of projection for the piriform fossa. So can you show us in the bone, when we age, which is the area that I'm going to inject here, deep on bone, to restore that loss of bone structure?
Okay, so let's take the fat compartments, let's clear everything.
Right, and also Frank, as you are explaining
No,
this
it's
fossa, can you
disconnected.
then later show us
Disconnected.
facial artery, at which plane it's facial artery, and the reason why I'm going to go deep on this area?
All right, while he's bringing up your
happened?
anatomical landmarks, just to get back and interact with the audience, we have one question here.
Right.
I have a questions about the laser. I think for this patient, laser should be done first before the filler because
Right, so I
It's possible
agree.
that this one gets,
Listen, in this patient, I can tell you another 25 things that I can do in my clinic on her. Okay, so I'm here explaining HA. So I agree, we can do a resurfacing laser, CO2 laser, you can do a fractional laser, you can do skin boosters that we're going to do later because you guys are so fast. You don't give me time to show you everything that I have to offer you. What is incredible is that with this range of products, we can take care of everything. We're going to give support and lifting capacity. We're going to fill the nasolabial fold with OBT. But also, I'm going to take care of the skin boosters with, of the lines with the skin boosters later. If you combine it with a laser treatment, I totally agree this is the future or the present. You know, I think combination of treatments for the future will give us much better results. And I agree with you, she will benefit from a CO2 laser, fractional CO2, fractional erbium laser, depends on what you have available in your clinic. Totally agree with you. Okay, so let's go to the piriform fossa. Now in this area, remember we have facial artery and we have anatomical variations. There is a study that demonstrates that sometimes we can have a little bit of the artery coming into the nasolabial fold itself, okay? So we have to be aware of that, and that's the reason why sometimes when we treat the nasolabial fold, we can have a necrosis of the ala of the nose and also this lip area. So the depth of the facial artery is intermediate. It's not superficial, it's not on bone. It goes in between the fat pads with the muscles. So if I go completely perpendicular, I'm going to go completely perpendicular to the piriform fossa and I'm going to touch the bone. Look, all my needle is in. So if I am unlucky and we have an anatomical variation and artery could be there, I will be safe because I will go through it and I'm on bone. Relax. Okay, 0.3 to restore that volume, that's it. And now I can do the rest of the nasolabial fold. I don't want a lot of product superficial in that piriform triangle because if not, when she smiles, it will be visible.
Right, so you're just offering support in this area. Right?
Exactly. I'm restoring the loss of bone structure in this area. When we age, that bone, that fossa becomes bigger, opens the piriform fossa. So I'm replacing a little bit of bone structure there. Because I'm in my clinic, I'm not going to open a Nasha technology for only this point. I'm doing it with Define. Because I am going to continue with the treatment of the nasolabial fold. I am going to go with my needle pointing medial, because if I go in the nasolabial fold itself, part of my product is going to go up here. So I need my product to go to this area, so I'm going to go a little bit more medial. And here, I am parallel to the skin, okay? And look, I am in deep dermis. I can see the shape of my needle, but not the transparency of my needle. So I will infiltrate, linear threading, classical thing that we were doing 15 years ago. Okay? Second point, I calculate the distance. I haven't touched, still clean. So second point, parallel to the skin. Okay? And that's it, very slowly, linear threading.
And you're doing a retrograde injection.
Retrograde injection.
Right.
Okay. And look at that. But I think that in the past I was doing superficial in this area, and now I'm more in favor of the deep, positioning the product deep, okay, to restore that volume. Can you sit up a little bit? Okay, look at that nasolabial fold. Okay, look at now this Oji curve that we have in this side. Okay, and look at this nasolabial fold.
Okay, we can.
Compare to this nasolabial fold. Okay?
And you didn't have to use much product even.
Well, I did use 0.5. Okay, so at the end I used 0.5. I am trying to use a reasonable amount of product imitating what happens in our clinic. Okay? So
Yep.
Frank, are you ready or do I go for my next indication?
I think we better go to the next indication.
Are we on screen?
Right.
No.
So now I want to do the teardrop. You're all waiting for the teardrop and I will leave this for the end. Okay?
Am I on screen?
Now, we have seen Vital Light, which is my personal option. Look, indirect approach. If you see, can you look at the camera? You see how deep this teardrop goes till here.
Yeah.
But you have seen that the shape of the tear trough here is more horizontal.
Right.
We have given support by treating the mid face,
What do you
okay?
mean, you mind?
So this is important to know. This
okay,
is
so
less deep
Right.
compared to this other side, and I have not treated yet. Now, she is a person that has thick skin, and she has a very deep tear trough and palpebromalar groove. The amount of product that I will need with Vital Light is too much. I don't want any product to be injected in this area that I need more. If I need more than 0.6 or 0.65, then I need to think about another product, because a lot of HA in this area is not a good thing to do. So I need a product that gives me lifting capacity. I will need less product, but at the same time will retain less water. So in my case, in this case, I'm going to use Nasha Technology Restylane, the classic Restylane.
Could we have her smile, please? Because
Yes, can
somebody's
you smile?
asking if it's changing the smile.
Smile. Okay.
All right, good. No,
Now
it's
look
clear.
at the improvement also of
Yeah.
those lines as well. You know, these lines by doing this treatment
Yeah.
without over volumizing. Remember, this is what we're showing. No over volumizing. Okay. So I'm going to use the classic Restylane, the Restylane, you know, the one that we know from long time ago. Okay.
Right.
So I'm going to do my entry point again. Remember that Nasha Technology retains a little bit less water than OBT. And the reason why, if you see my hands, okay, and you see here, because of the mechanical cross-linking, there is less space to retain water in between my hands than if I have this configuration. You understand?
Yep.
So there is more space for water retention in a linear or OBT than if I am more compact. There is less space for water retention. That's the reason why Nasha retains less. Because she has a severe tear trough, I'm using Restylane, okay?
And by using needles or cannula.
No, in this area I prefer cannula, I need safety.
And do you have
This is
any reservations of which direction the opening is, up or down or lateral?
You mean the bevel up or
Right.
down?
Yeah.
No, if I am under the muscle, it doesn't matter if I go with my bevel up or down. I mean, I don't think it plays any difference. My product is all going to be under the muscle.
Makes
okay?
sense. Yep.
Do we have a needle? 25.
Could we have the camera zoom out just a little bit?
Yes, can you zoom out?
That's perfect. Yes.
Right. So same technique. The only thing that I'm changing is actually the product. Okay. So close your eyes. Close your eyes. Can someone translate her?
I don't know what
Right.
you're doing, but
So entry point, pinch the skin. Always pinch the skin. And only enter with a little bit of the needle. I don't need to do all the tunneling and everything, because if not, I have more chance to bruise. Hold like a dart. Wait for the bleeding, which she doesn't. Okay, there it is. Easy. Now I'm going deep on bone, and she will complain. Now, she doesn't complain because she's very nice. And I paid her a lot of money.
And maybe it's the lidocaine you just did in the midface.
Right, so now I'm deep, okay? And I am only going to inject a little bit. Can you zoom in now? Zoom in, cameraman. Zoom into the tear trough, that's it. So I am going to infiltrate 0.05. Look how it's coming up here.
Yeah.
Okay, we can see that it's starting to look less dark. I keep going, 0.1. And I want to do a 0.05 extra. Now, this is molding at the same time. Okay? If I'm using this product, I will never do a superficial deposit like I did with Vital Light. Okay? So I keep going lateral, the same technique. I keep going lateral, same technique. Okay? And I keep going lateral for the palpebromalar groove. Okay? That's it. Total of 0.5. I still have 0.5. And I'm not only doing tear trough, I'm also doing palpebromalar groove.
Right.
Okay? Now, open your eyes. Open your eyes.
Frank? Frank?
Yes.
Can you
How
see
are
this?
we doing?
Are we doing fine?
Okay.
Right. So I am just molding her. This was Restylane, the classic Restylane, and we can see the difference between this teardrop, okay, and this one. Can I still improve her? Yes. Which product I will use in 15 days if she comes back to my clinic? Vital Light. I don't want any more Restylane here, the classic Restylane, so I can use a combination and use Vital Light. This is what we're going to do now, because I'm not here in 15 days. I will not do it in the same session. I confirm in 15 days that everything is okay, there's no water retention, no lymphatic drainage, obstruction, nothing. But now she comes back and she says, "Doctor, I like it, but I need a little bit more." This is what all our patients tell us, right?
That's true.
So I have my Vital Light, look at the clicker, okay? This is Vital Light.
The Vital Light goes superficial.
No, I'm going to go deep first. Remember, superficial in the teardrop is not a good idea. It's just because you are advanced in that audience, I did it.
Okay.
But first, I will continue with the deep plane a little bit only.
Okay.
Okay, I will do the superficial at the end, only for very advanced injectors and people that can think of having a little bit of water retention if it happens 3 times in 3 years in my case.
I'm
Okay?
just showing that in the holotome that it can seem that it's the same place and it's not safe because the vessels, as you can see, are close by, but there's a space in between because when you are on bone, you're safe. The vessels are in the SMAS, either below or above the muscle, almost always. So that's why it's important to think in 3D. If we move this, you will see that wherever he is, if he's deep, doesn't matter that apparently the vessel and the vein travel around there because we are not at the same depth, and that's part of being safe. That's why having these holograms in 3D allows us to understand the depthness. So if he's doing that, he's going, for example, through muscle over there. He's going not on the deep fat because the deep fat will be lateral. If I take the muscle out and I put the deep fat, you will see that the deep fat doesn't arrive all the way to the teardrop. You see,
Right.
it's lateral, so you're on bone. You're perfect.
Right, guys, so this is it. Okay, I've done a little bit of Vital Light. Remember, not in the same session in our clinics. Okay, so I will do it in 15 days, but this is the result. Can you zoom out a little bit? Okay, that's it. Can you sit up? Sit up. Look at the camera.
Yes.
Okay. Right, so that is the
Comfortable,
result. Okay, keep molding because we have done the 2 treatments in 1 session. Sometimes, remember, I see this. When we treat the teardrop, sometimes we have a hollow here. This area may be a little bit hollow, okay? So when I have this, I normally have my Vital Light that I have used for the teardrop, and I can do a superficial deposit there. I'm going to try to do it for you. If I see, because I don't see the entry point. There it is. So no.
So while you're doing that, could we take
So
just
look-
one question?
Yeah, sure. You make me questions, but look how superficial I am. This is a dangerous zone because we have facial arteries, so I need to be extremely superficial here. Okay? I don't want to do it with a needle in this area. I just want a 0.1 to avoid that sunken area in this. Okay, so that's why I'm using a cannula and Vital Light. It was a drop. I'm not even using 0.1.
So
But
like
I
I said-
avoid this hollow in this area.
Okay, well, I'm just going to take just one question.
Right.
Go ahead.
So thank you for your nice presentation. My
You're
question is about skin quality, patient skin quality. Do we use skin booster at the same session?
Right. Very good question.
For this patient, if so, how many CC or how many products you plan to use for each cheek or each side?
Thank you.
Very good question. If she comes to my clinic, it depends on the expectation of the patient. If I have a patient that is worried about the volume on the cheekbones, I want something very natural, I really am afraid of these treatments, I don't care if I have a little bit of nasolabial fold or saggy skin, my first choice is to prepare this skin with skin boosters. And I will propose her a 2-session. The last studies from Galderma show an excellent result with 2 sessions. And I will use 1 ml per side. And this is just because in our clinics, we cannot afford sometimes to inject with more than 1 ml per side. I will focus on this area, the cheek area, use 1 ml in this area, as we're going to do right now, and then 1 ml in this one.
And
she comes back in 3 weeks.
Okay.
Then I do a second session with 1 and 1 in the same area, and she will have also a lifting effect. Remember that Nasha Vital, still a Nasha technology, and I have seen a lot of cases and colleagues from from other countries that they only focus on skin boosters, and they do have a lifting effect due to the capacity of Nasha injected superficially in the dermis to even lift the skin. That will reduce the amount of product that we will need deep later. But if I have a demanding patient that she comes to my clinic and she really wants to see a very evident result from the beginning, the improvement of the nasolabial fold and the saggy skin and everything, then I will start with the treatment that we are seeing now. So it always depends on patient expectations. Okay? Right. This is my skin booster. This is Vital, 20 milligrams per milliliter. Remember that we have the clicker, the system of the clicker. I think it's really great. Okay, so we're going to press the clicker that allows us to have a 0.01 deposit. So it's 100 injections per milliliter. Okay, the first 1 or 2 clickers, you won't hear the clicker till you see the exit of the drop. And what I'm going to do now, I'm just going to make sure that I'm not too superficial. The only problems that I have seen with Vital is a deposit of a too superficial deposit in the skin. So I make my patient smile, right. So now I can identify where she needs a little bit more support. Relax, relax. Can you tell her to relax?
Okay, we'll just take one question while you're doing those
yes,
lines.
sure.
Okay, go ahead, please.
So thank you for the fantastic injection. My question is that would you like to, for just optimizing the results, would you consider doing few boluses at the angle of the mandible and somewhere in the periauricular area, somewhere in the parotid area?
Right, you have to remember this session is personalizing the mid-face.
Well, anyway, I will answer.
That's a good question. Anyway.
You know, if I could, I would inject 22 milligrams in each of my patients. Okay, I can improve this. I can also improve the support of the mandibular border to also create a second vector. So we have done this vector, trying to lift from here. Sorry. Okay, trying to lift from here. This is the vector we've done. If I can also do this lateral vector from from the lower third, trying to lift from here, this is also something that I would consider. But of course, we are limited in the amount of product that we can inject per session. If this lady probably will be quite happy with the result, and sometimes we have patients that really can afford another session, then I will do a support here. I will create all this support, okay, and then I will do also the jawline, and I will create a second vector. So I agree that I can do this. But with this limited budget today, and she's now 1 ml of lift, 0.5 of Define, 0.5 of Restylane, and 0.5 of Vital Light. So this is a 2.5 milliliter for this face, half face. This is going to be a 5 ml treatment. I don't think she can afford an extra 2 or 3 ml per side for the lower third, but definitely I would do it, okay? And we're gonna see that tomorrow. Tomorrow we're gonna see all these treatments of the lower third. Right, so we keep going with the skin boosters, okay? So look at the angle. If I go completely perpendicular, I might be, I go through the skin and I'm more risky. I want my product in deep dermis or immediately subcutaneous, and I have one click, 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 click. Every centimeter I normally, have, one of these points. Obviously, patients are gonna bruise with this technique. I always tell my patients that they are gonna bruise. I recommend them arnica cream or something for the next days, eyes, but it's nice. So also in this area, when you have deep, crow's feet, you can also use, but remember the aim here is not to see a blanching, a lump. And if I see a lump or something, I need to stop and I need to take care of that lumping immediately, because if you go through days and you see that lumping, it might be very difficult to get rid of it.
And how would you take care of those lumps?
No, I just immediately, I try to mold and make those things disappear.
So you make sure that she doesn't go out of your office with those lumps.
Exactly. So
right.
I can do all the chicks. So I'm going 0 every centimeter, 1 click.
Okay, while you're doing that, we'll just take some questions from the audience.
Sure.
Go ahead.
Hello. First of all, I'd like to congratulate you and thank you for a beautiful session that shed a completely new light on Restylane and the new products. And this is just the first session, and this is how impressed we are. So congratulations.
Thank you.
The second thing I wanted to ask is a question that I always thought of. If you were in a case like this, if you were to choose, you want to do like an overall treatment, would you choose to do the fraxilated treatments or whatever, the skin texture treatments first, or opt to go for the fillers? And if you do either, how soon after can you continue the treatment?
Right, so as I said, it will depend on the expectations of the patient. It's always good to improve the quality of the skin first, but sometimes if we do a skin booster, she looks a little bit better, but she expected more. So as soon as we put our hand in the face of our patients, they think they're gonna look like Angelina Jolie, all of them. So it depends on my patient. This is why we need to talk to our patients, and if she is a non-demanding patient, I go for the skin boosters, okay? I go for a fractional laser, okay? I have a CO2 fractional laser and a nervium laser, both, okay? So I will go in her case probably with a CO2 fractional laser, and I will wait up to 2 months because I don't want any hyperpigmentation, or if she has a little bit of hyperpigmentation, we have a reactive melanocytes, and I don't want any pigmentary problem due to the laser plus the filler, okay? So I would wait for 2 or 3 months for the filler technique. The skin booster can be done with the laser during those 3 months, okay? But remember, I will go first for the filler if my patient wants immediate results. Okay, so we have done this. Let me just a little bit of cream.
All right, while you're doing that, just one more question.
Sure.
Go ahead.
Hi, Dr. Juan, Dr. Frank, Dr. Soufiani, thanks for the great effort and the wonderful presentation. I have just a question regarding the nose. If the dorsum of the nose and the columella,
right, so we have,
18%.
let me just stop you because you guys want to know everything. I have a lot of advanced people in the audience, but we have after lunch a session only with 3 noses. So we're gonna talk about all the noses just after lunch, if you don't mind.
No, that's fine.
Thank you.
Sorry about that, my friend.
They're just overzealous and excited because...
Right, no, we're going to talk about everything, guys. I'm here to talk about everything. We 3 are here. Look at the final result. Look at the camera.
Yes, that's
okay.
good.
This is a quite nice result for 2.5 ml in total, okay? Do I still can improve here or here? Of course I can. Look at the camera. But look at this side, okay?
Have her smile so we can see the fine lines as well.
Can you smile? Smile, Wata?
Oh yeah.
Okay, look at this. Wata, come on. Okay, look at this. Okay, look at this. Come on, Wata, come on. Okay, look at that. Okay, that's a nice improvement, although there is a little bit of lidocaine effect probably in the area also. So she might have a little bit more wrinkling later, but I think it's a very natural result.
I mean, considering her severe photoaging, come on, Juan.
But listen, Soufiani, the teaching thing here is look at this improvement without over volumizing. I insist. This is why I'm so excited with these products. And I went back to Nasha technology, that these were the products that I started 17 years ago, injecting here and here.
Right.
And I left them because it was the fashion of the volumizers. And now I realize the magic that we can do with Nasha again in this type of patient. And then the one next that we have. This is not finished. Come on, let's change. Okay.
All right, Juan, I do have a very, very important question here. I think it's worthwhile addressing. I have a question saying if when you're using skin boosters, can you use a cannula for the sake of bruising? And if not, why?
That's a very good question, Mohammed, to be honest. I like a lot the use of skin boosters with cannula, okay? If it's a case like the older lady that has just left, I might go for the injection technique with the clicker, because also we will have a little bit of effect creating collagen due to the number of injection points. So when I really need a lot, it's like a derma roller. So I'm doing a skin booster with the product, but at the same time, I'm doing 100 injection points in the cheeks, and that is creating a little bit of a fibrosis, a little bit of collagen production due to the injection. If I have a younger lady or a thinner skin, and I don't want my Vital to be visible, injected in the surface of the skin, then I might go with a cannula, like doing something like this, okay, fan technique, cross-hatching from two sides, okay, giving support to that skin. It's not the case, I'm just using the patient to demonstrate, but I mean, I would do then a cannula treatment. I like a lot Vital with the cannula as well. So, but the difference is when I need a lot or thick skin, I prefer the clicker, okay?
That's a very comprehensive answer, actually.
Right, so we have 4 patients, but not last, we have one more. Again, can you sit up? What I want to do here is to show you the possibilities of changing the shape. Remember that when we evaluate, the shape is extremely important. So when I evaluated this patient, she had a very round face, a little bit square in the lower third due to the masseter here. There is, I mean, we can always improve this, okay? But she had a round face, but she still want to improve her tear trough, her nasolabial fold. If you see her on profile, look at this is not a true marionette line that comes from saggy skin and everything. This is something that comes due to the ligaments that we were saying, and she has a round face. So what I want to show you is the capacity to improve this kind of patient that years ago I was going to say, well, it's difficult, maybe you need to go to surgery or something, because I didn't want to infiltrate any product here. Look at the volume that she has.
Yeah, she has a very nice volume there.
And she has enough volume. So, does she have a thick skin? She's young. If you palpate, you cannot palpate, but she has a thick skin. So my product of choice here, again, is going to be lift, because my priority here is to lift and give this nice contour. What I want to teach you here is how to make a person look thinner with a filler, because a lot of our patients think that by injecting a filler, they will look more fat or round, okay? So we're going to take the lift, and I think, Frank, are you ready with your holotome to show us all the lifting area and all the injection points that I'm going to go lateral?
Yes, yes. Okay,
Right.
so...
Show us the zygoma and the tower technique.
Exactly. So if we go and we take the skin and we go back to the bone where we're going to inject, and we rotate. So the technique is called tower technique or pyramid technique because I'm from Mexico. But if we start with the points of injection to provide lifting, then we use the bar that you see there, and we can start on the bone. Just a little lag.
Right. So I'm going to start at the same time doing my injection. My first point is going to be the zygoma, Frank?
Yes.
Okay.
You can see the 3 or 4 points that you can make
So
there on the bone. Now I'm going to put the deep fat on top. You see that there's no deep fat exactly on the bone. What we have is the superficial fat. There you go. And you can see the points translucent through the fat. And now I'm going to paint exactly on top of those 4 points. There, 1, 2, 3, 4.
Exactly. So that's what I'm doing now.
Exactly.
So
and now
I
you're
reach the
going
bone.
all the way up to skin. I'm sorry.
Yes,
And
I read.
while-
Yeah.
While we are translucent with the skin, I again, in color red, will paint on top of those 4 points.
Right. So every 1 centimeter or 1.5, I'm going on bone,
Yeah,
and I
that-
start
that
my
last one, no?
bolus, and look how my needle goes out. I still infiltrating, and I stop before I leave the skin.
So
Okay.
you can go, forget the last one, but these 3 points are the lifting points on top of the zygoma, which we use as a bar to lift all the way down to the lower third, because we can take off the jowling, we can take better also the marionette area here.
Now you can see how I
And
move
here.
my needle, trying to find the bone. If I don't find the bone, I don't inject, because this is a
as you can
dangerous
see, it
area.
has to be on the bone.
That's it.
How many do you have already?
I have done 4 points.
Okay, perfect.
So from the zygoma, going all lateral, you can see the entry points with a little bleed in here of my 4 points. Okay, going all along the zygomatic arch, more lateral than usual, because what I want to create is this image. Can you sit up? Okay, look at this. Okay, we are making her look thinner, and we have now a shape, and we are creating a very nice, elegant, for a young lady, cheekbone. This is a square face. Look at this face, it's a square, completely square. Can you zoom better, cameraman,
So,
here?
Could
look
you
at-
show like half of the faces?
Sure.
Look at the different depth of the points. Here you can see clearly what is on skin, what is on fat,
Zoom out a
and
little
what is on
bit,
bone.
just a little bit, that's it. Okay, so look at this face. Okay, we have a round and square face in the lower third. Okay, and look at this other face that we have a triangular face. Look at this shape. Look at the camera. Okay, more triangular. We have lifted with no over treating her again.
Could you move your hand from the background so we could see
Sure.
that? Yeah, that's more obvious. Thank you.
Sorry about that.
No, it's okay.
Okay, so you can also see that OG curve that we are creating. Look at this triangle and look at this other side. Okay, she looks more square. Okay, and actually what I want to highlight is how to make her look thinner.
Now what
Okay.
I wanted just to show is the vessels. Sorry, Juan.
Yes,
I
so
want
what
to-
I'm going to do while you show the vessels, I'm just going to treat her teardrop with Vital Light.
Exactly. So you can see that there are some vessels that are the branches of that superior temporal artery. Normally we have 2 there, the transverse and the orbital, but they are going on the lower part of the bar of the zygoma.
Entry
And
point.
if we see the nerves now, I'm going to put the nerves, they travel along the
Close your eyes.
same trajectory than the vessels. So the nerves are really not an issue here with the treatment. Remember, it's a treatment not to provide volume, it's a treatment to provide lifting. That's why we have this tower technique. We're trying to do isolated points, not to volumize and have lateral projection.
Yeah, that's quite clear, Frank. Thank you for showing that. And I'll just take one question here from the audience.
Sure.
Yes?
Good afternoon. Just I'm asking about the previous case. Can we add botulinum toxin to the T-trough area for the fillers?
Sorry, I don't get the question.
So he was asking, is it possible to inject neuromodulators to the tear troughs?
So that is a question that he will have to answer after we finish today.
Yeah.
Okay?
I'm really looking
This
forward
is
for
not the issue for this event, and I do a lot of things in my clinic, but when we finish, I want to talk to you, my friend. Okay?
Yeah, I
It
have
will be
his
a
name.
personal recommendation. I'm not allowed to talk about other things here.
Yeah. So
Actually, you don't see the policeman that I have behind me. Galderma has contracted a policeman because they know that I'm tough.
So
Okay?
you're putting boluses here just to
Yes,
correct
I'm
it?
just doing the tear trough the
Right.
classical way, but I want to show you one thing on her, okay, which is the lateral approach. This is I'm not going to do the superficial now. I just want to show you, okay, the lateral approach. Can you open your eyes? Right. So she still need a little bit, okay, she has eye back. Be careful with patients that do have eye back, okay, the herniation of the fat in this area, because if I try to correct 100%, part of this product can herniate through the muscle as well. Even though we inject deep, part of the product can go through the muscle and you can have a Tyndall effect or a retention of water. So when they have eye back, I always maintain that little tear trough compared to this other that we, okay? I just wanted to show you also that there is a possibility when you have a lot of palpebromalar groove, you can also do this lateral approach for this area, okay, which is what I want to show you to finish with this patient. Okay, so entry point, same technique. We're going to go under the muscle. Sometimes we need, can we go down with the chair a little bit?
So you're
That's it.
going as well under the muscle in that part, right?
Yes, so we will have the retaining ligament here. It's a little bit tough sometimes to go through it. You will palpate the resistance.
There
But-
you have the muscle. It has to be, tear
Sorry?
trough has to be under the muscle, always.
Right. So I'm doing exactly the same. I wait for the bleeding to see the entry point. Now I get in and I go through the ligament. There is a little resistance here, but I still under the muscle. So if I do like this, I don't see my cannula.
Right.
So when I have a very deep palpebromalar groove, this is also another opportunity to do this treatment. And now I do my linear threading. This is Vital Light. I won't do the superficial deposit in this area, always under the muscle. I can actually go to the corner here, okay, for that sunken area, always with the resistance of the ligament. And I finish with 0.25, 0.3, just mold with a gauche. That's it.
Do you release the ligament before you inject, or you
Yes,
inject
I have to
right?
go through the ligament to get into this area, but I am under the muscle, okay? I sometimes have to go through the ligament. I only do this with Vital Light, okay? Because it's a nice product to do that. And you can see that latter, can you look at the camera and go like this, okay? We can see that she still need a little bit here, but we have corrected better the palpebromalar groove, okay? I will finish the treatment later because you have seen this, and we have a last patient before you go to lunch. You're getting hungry. But you know, this last patient, it's a compilation of everything. I mean, you're gonna see our last patient, and it's a combination of everything that we have seen today.
While you're transitioning between patients, let's take a couple of questions. here.
Right.
According to the tower technique, what is the amount we inject from central to peripheral or medial to lateral? We start by big amount, then withdraw by little amount, or the same amount all over the zygomatic arch.
I'm sorry, you have to. Did you get that one?
No, I
'Cause,
didn't.
Could you
I
repeat the
What is
question?
the amount? How can you inject in the zygomatic arch in tower technique?
Right, so
Okay.
I have
And
injected,
what is the percentage between them?
right, I have injected 1 ml, okay? Now, remember that the tower technique and the zygomatic arch, it's normally done with lift, and it's normally for patients that need a lot of lifting and have a thicker skin and more volume, round face. So more than 1 ml in that area, I don't think it's needed, or you will over-treat, over-project. Okay, so from the zygoma, first point, and the other 3 points lateral in the zygomatic arch, you know, I think, 1 ml maximum is what you should do in the first session. Of course, when they come back, you can do something else. Can you go up?
All right. One more question before you go.
Yes.
Go ahead.
Just I'm asking this patient.
Sorry, I don't hear.
This patient, as a young patient, would you use Restylane Define rather than the Restylane Lift?
You mean for the last one?
Yes.
You can do Restylane Define because she's young and she doesn't need a lot, so I agree. But you have to think about your priority. So if you need to make someone who has a round face thinner, I think I will use less product with Lift. I can do the same or similar effect with Define, but I will need more product. Can you focus on me just now a second? Let me answer, this is so important. This question goes, so this question goes with the slide of the anatomical, the pathological slide. Remember the anatomy, the pathology slide with the ball that doesn't integrate into the tissue and the one that OBT that integrates into the tissue? So if I have a round face, my priority is to push. If I let the product integrate into the tissue, it will become thicker. So you can have a similar result, but part of the product will integrate into the skin and you will make it thicker and lose a little bit more projection. But of course, Define, I told you, it's the versatile product that you can also make a little bit of lifting effect and contouring. You could have that option if you're limited with the product, okay?
Yep.
Let's go to the patient now.
All right, what do we have here?
So this is my final present for you on this session, because what about this patient? If I ask you any question, does she need volume? Yes. Does she need projection? Yes. Does she need lifting? Yes. Does she need, she needs everything, you know? She's so nice. She's my favorite one, okay? So now look at the things that she needs, okay? First of all, of course, she has, I have recommended her to be an actress because she's all the time expressing and moving, so but let's try it. So she needs definitely volume in the mid-face malar area. We can see a little bit of bone, but she has a very flattened, look at this, she has no cheekbone, she's flattened. Look at the flattened cheekbone. So she also needs projection and contouring. She also needs lifting, look at this. So she needs lifting. Okay, so she needs also hydration of the skin, look at this laxity. So this is the reason why if she comes to my clinic, first of all, I need to spend time on her to convince her that the number of milliliters that I'm gonna need on her, it's quite a lot.
Yeah.
Okay? If she agrees, today she's extremely rich, maybe every day, but today she's extremely rich. I am going to use one product for the lifting and projection area. Projection, lifting, this is one product. I'm going to use another product for the volumization area. Okay, we agree with this. She needs volume here, she needs projection and lifting here. And I am also going to do a double layer treatment. Because when we have a patient like this, if all the product that we inject is on the deep layer, we will need a lot of product. So if we do a combination, combining the deep layers and the superficial layers, the superficial fat pads, then we will need a little bit less and she will have a better result in terms of hydration of the skin, luminosity, also improving the very fine wrinkles when she smiles. So I'm going to do a double layer treatment, okay?
Frank, could we see the relationship between the deep and superficial fat pads in the cheeks?
Okay, so I will take the skin first out and I will take the muscle out. So you have here the deep fat pads, and now I'm going to put the superficial. And as I move it,
you have to slow down, Frank, because there is a lag in the signal.
Yeah. So I'm going to, there
Yep,
you have
yep,
the deep
it's
fat.
coming. That's the deep fat, yeah.
And now you have the superficial. And as I move it slowly, you can see from the side that there's a space between them.
Yeah, that's quite clear. It's showing the relationship of those two.
Yeah, over there. Now, like I said, this is the hamburger. So what is coming in between?
The meat.
Is the muscle. You see? Slowly it's going to come back.
Okay.
Yeah, you
and
can
that's
go.
the difference between deep and superficial fat. And both of them can be treated in the mid-face. Both of them are necessary for a good result. But depending exactly on what the problem is is. It's either
And,
volume
right,
or
and
alveolar.
Juan will show us on this patient.
Right, so what I want to show you is, let's start with the lateral part, okay, the projection and the lifting. We have two options of product. One can be defined, the other one can be lift, okay? We all agree with this, now we understand. Does she have, I need to take a decision. Does she have a thick skin or a thin skin? Look at this. This is not the type of skin that we had with the older lady that we did the skin boosters.
No.
This is not the type of skin that we just had with the previous patient, the young patient that I did the tower technique. This is a very thin skin. If I inject Nasha technology in the zygoma and the zygomatic arch, we're going to improve, but it's going to be visible because the tissue quality above the product is very thin and it's not going to look natural. So this is the reason why my choice of product for the lateral area is going to be defined, OBT. A little bit of tissue integration, but at the same time give support and lifting, okay? Let's go. So, relax, okay? So, stretch the skin, first point, lateral zygomatic arch. You can see that immediately, we can see the bolus. Look at that. I can immediately see an exaggerated bolus. When I see my exaggerated bolus, I stop. It has to be exaggerated. If not, I will lose the projection when I mold. So now look at this exaggerated nodule and everyone is, oh my God, what is he doing? This is OBT, easy to mold and shape, okay? Actually, this is her bone, okay? Now we are going to create a little bit of smoother transition, okay?
Yep.
Second point, going same area, little bit lower. We're going to create, we could do this with a cannula as well, I agree. 0.25, that's our second point. Again, exaggerated nodule.
So
and
just to differentiate between this injection technique and the previous one, this is just bolus, not a pyramid technique.
Remember that when I need projection and lifting, I prefer the bolus technique. The only difference is that here, I don't want an artificial high cheekbone because she has no volume at all. So I'm going to add another 2 extra points lower at the end, okay?
Right.
So now, can you stay like this? Third point, point of maximum projection. That's my third point. 0.4 here. We need to create some structure. And I will leave 0.2 for the other two. Look at that exaggerated nodule. I now mold towards the lateral part and we're starting to create, okay, the shape of the bone. Okay? Finally, I want a little smoother transition. So what I'm going to do is under this area, I'm going to go to deep dermis and I'm going to go in this area to create a smoother transition. Okay?
Frank, could you mark the, in different colors, the placement of bone and then the above superficial pad or deep fat pads, what Juan is trying to do and achieve here?
Can you repeat it, please?
Could you mark with different colors so we can see it on the holotone, the placement of bone and then the superficial fat pads, and show the if the products were in different color and you can see through the patient how it would look like in your holotone.
Right.
Right, okay, so remember, I'm not seeing exactly what you're doing, but the products are,
so he's just injected over the zygoma, and then now he's putting superficially some of the product.
So the zygoma is again, our target, and what we're trying to do is define. So we're going to have some point of volumization probably around there. If we go, you're doing the 3 points?
Yeah, he was doing the points, yes.
Okay. And this
Okay.
is how the points look below the superficial fat. I'm putting just
Right. Okay?
Okay, Juan, you
So,
can proceed.
we have done the lateral part, now I want the medial. So I'm going to do exactly the same that I did before. With my Restylane volume, I will pinch the skin in the direction that I want. I have to tunnel in the same direction. This is Restylane volume, and I'm going to go deep to the deep fat pads and bone, supraperiosteal. Wait for the bleeding. I don't see any bleeding here. Okay, there it is. Now look, again, I'm using all the time the same size of needles and cannulas. Now I want to go deep. To help me go deep, I pinch the skin, so I make sure that my cannula is in the deep plane. Look, I'm touching bone. And now I can do, first of all, my bolus, put my finger in the no-go area, and I start, first of all, with a bolus, because I want some projection as well, and I want some product to be in a bolus, you know, deposit. I'm actually touching the bone. If I was touching a nerve or an artery, all the behavior of my patients have been extremely good. The first alert sign when we are in a vascular structure, I think it's pain. So it will be an alert sign if we have pain. Once I've done my bolus technique of 0.4, now I start doing my fan technique. I still deep. If I do like this, I don't see my cannula. And I will finish my milliliter doing all the contour, okay, creating a continuous convexity with the lateral part. But this product has a bigger particle size. In a few days, will retain more water, and the particles are bigger, so it gives me bigger volume in this area. Remember, in this case, we're putting everything together, combining the treatments, okay? Now I'm doing my fan technique. I'm actually here, and I finish my milliliter. And this is what I want to show you now when I finish my milliliter, is that there is always place for a little bit more. Okay, although we have a good improvement, okay, we mold, we do have a good improvement here, but look at the camera, sit up, okay. Now, I want also some more improvement. Look, after all this, she still have a little bit to improve here. She still have a little bit to improve in this area. If I go deep again with volume, I need another ml to see the final result like this that I want. So what I'm going to do is I'm going to go more superficial. And based on tips, remember the tips that I presented you, helping you to position the products. One of the letters is I, tips. Okay, so the second letter is I. Depending on the injection depth, we need to take a decision on which product. If I am injecting more superficial, I don't want volume because I don't want her to be like this at the end. I am going to use Refine because it's a product that it's more suitable for a superficial injection or superficial fat pad. So from the same entry point, I am going to go with the same technique, pinch the skin. I try to use the same hole, entry point, I'm in, but now look, I am going to go superficial. And when I say superficial, I'm subcutaneous. Okay, this is only, you can do it with a cannula. We're using a 25E cannula. And very slowly, with only 0.5, I am going to help this skin to increase the thickness, to have a better hydration and moisturizer effect, to improve the fine lines with less quantity. Of course, we can keep doing the deep layer, but I think this is a nice, way to do it. Okay?
And I think this is what we were talking about having to understand the injection anatomy and the difference between superficial and deep fat pads and over bone injection,
Right.
and really personalizing the products to not just indication, platforms, and patient needs.
Exactly. And I also can do a softer transition. We can try to go to the other side, okay, to this side, to do a softer transition. I don't want any visible product. Now, you can see how visible was this bolus, and this is defined. Imagine if we inject lift in this area. It would have been really visible and unnatural. That was the reason why I decided to choose the OBT range, okay? That's it. 0.6. We're done with that. Little bit of cream. Okay, look, even here we can still see a little bit of the structure of the product, okay? So let's, wait, we're gonna do tear trough. So look at the camera, look at the camera, go like this, okay? And here, we have restored that volume at the same time giving some, you know, support to the bone.
Yes.
Okay? So finally, I'm going to use I want to finalize again with the tear trough because I know it's an area that you really are interested on, and I'm going to still use, you know, the same product that I used here. So I'm going to use Vital Light, sorry. Okay? You can use Refine or Finesse also. You could use Finesse, for example. Okay? I'm just so used to Vital Light with excellent results, especially with these dark circles, that I want to show you what I do in my clinic. Okay? You can see that this side that we have treated was in much worse condition.
Yep.
So this is the reason why we started here, because if we start here that she doesn't look that bad, you will never get the same result as this one in this area. So she will always look sunken. Okay? So final point here for the mid face. This. Okay? Entry point. That's it. Again, Vital Light. Hold like a dart. No bleeding. Let's wait for the bleeding. Okay. There it is. Right. I'm deep again. I touch the bone, and now I go towards the medial part. And I start injecting under the muscle. You can see how my cannula is not seen, and I can see how the skin is being lifted. Remember, this is still Nasha technology. It has capacity to lift. Do the small deposit. Now I change. When I change, I pinch the skin very slowly, very smoothly. Okay? Now I keep pinching the skin when I have to change the direction, because I increase the resistance, and it's easier to go through a resistance which is a firmer resistance. Okay, now I go to this area, and finally lateral. Little bit of cream to mold, Vicky. Right. And I finish there. And now I do a drop in the surface. But in this case, she has such a thin skin that these are the cases that we have to be careful if we do a superficial deposit, because a little bit of water retention could be also visible, okay? So when they have such a thin skin, I prefer not to do the superficial deposit until they come back and I explore the possibility of the retention of the water, you know, in the deep layer. Sorry about that. It was a little bit too much cream. Right, combination, lifting area define and projection, volume deep, refine a little bit more superficial, and my Vital Light for the tear trough in a complex patient that needs a little bit of everything. But this is the reason. If at the end you are going to open 3 or 4 or 5 mLs for this patient, why are you going to open only one type of product when we can open 4 or 5 mLs and personalize which area do we want? Okay, look at the camera. Okay, this needs to be molded a little bit. Victoria is going to do that, but I think it's a good result. Okay?
It is, especially that this particular patient is relatable here to this region and area.
Right, so come back to me. Just to finish, can you show me now, cameraman? Just to finish, I want to highlight one thing. We started with volume and indirect improvement of the tear trough. We went to define in a young patient to create a nice contour and cheekbone area. Then we moved to lift into a thick skin, older patient that we had to do also the skin boosters. Then we did lift again with the zygomatic arch to make someone look thinner here. I definitely need that treatment, okay? And finally, we have a combination of everything in this patient, different layers, different products. Real personalization of the meat face, okay? This is not everything. After lunch, we have noses, we have a section on noses, and also we have the upper third, which is a complex third with personalization, different products and things to do. Thank you, because I loved a lot of questions that you made.
All right, good job. Thank you, Juan. So I guess we could break for lunch now, and we'll see you after lunch. Thank you, everybody, for holding up so tight.